Hi everybody, good morning. It's Dr. Missy. It's day 35 for this COVID infected surgeon to give you her update. I'm going to do this a live update. You can see I still have bags under my eyes. I didn't put any makeup on for you. A lot of sleepless or poor sleeping nights, but last night I slept very well. I only woke up one time, and that was good. Got a lot of sleep. I don't have a fever. My pulse ox is 98. I feel better. I feel like in the last 12 hours, I've really turned the corner. I have decided, I'm not sure if it's going to be today or tomorrow because I'm a little nervous to do it, but I think what I'd like to do is to stop taking Mucinex and stop taking zinc. I'll keep drinking a lot of water. We're going to keep doing the pulmonary toilet. We're going to cut that back to 2 times a day, once in the morning, once for sure before bed, and then the middle session around lunchtime or supper time, or in between lunch and supper time, will be on a PRN basis, which means if I feel like I need it, either by the fact that I'm getting a rumbly cough, or I'm not feeling well, or I notice my temperature going up a little bit, sweating, chills, anything like that, we'll go ahead and do a 3rd session. I'm starting to back off on my regimen because I feel like my lungs are getting better. So I'm super excited. It's been a long journey, and I hope none of you have this kind of journey if you get it or your loved ones get it. But just know that you can survive a lot. And if you have the right techniques, pulmonary toilet, which means chest percussion, the lung drumming, and postural drainage, I really think you don't have to watch your loved ones or yourself get so sick that you need a ventilator, and so sick that they can't reverse the damage, so sick that you die. I believe really strongly in this. I will say I really need to give the glory to God, because honestly, I was desperate in the middle of the night on my 6th night, and it was 3 o'clock in the morning. I was worrying. I was watching news reels, and it came to me as I was praying to ask, please show me a way that I can help myself at home. Please show me a way. Sorry, I've got an itch on my nose, of course, because I'm on camera. I'm going to touch my face. Now I'm itching right here, but I'm not going to touch it. Anyway, I prayed, God, please show me a way that I can help myself. And I promise I'll share it with the world. And almost in an instant, I mean, it really was a miracle. I thought of something that I had used back in 1986. That's a long time ago. And I hadn't thought of this technique in years. And that was the pulmonary toilet that we used to use on the children with cystic fibrosis. So I taught Phil how to do it, and at first, because he's non-medical, it was scary. He was reluctant. I was having to show him, and so there's some tension there as to he's reluctant, and I'm trying to teach him, and maybe not being as patient with him as I should be, and him maybe not being as receptive as he should be, things like that. There's a lot of fear involved, both on the thumper, Phil, and the thumpy, me. I mean, when was the last time this orthopedic surgeon was the patient of an excavator construction worker? Never, right? So it was a very new role reversal for us. And anyway, now he's like I wouldn't want anyone else to do chest percussions on me. He's so good at it. And he's making it fun. He does chest percussions to the rhythm of I Will Survive and just all sorts of fun stuff that just make me laugh. We've been having a really good time lately. And like I said, the last 12 hours I've been doing great. So to all of you for your prayers, I really appreciate it. I'm so, so grateful to be alive. There was about a week there where I wasn't sure that I wasn't going to be one of the statistics of death. We were getting our financial things in order. We wrote up a hand will. We have a will, but we updated it with our most current information because things had changed since we actually made that will a long time ago. I spoke to my daughter about executing the will. You know, just so many things. So my dad's in charge of executing the will, but he's in his early 80s and he's getting reluctant to do that, and he's expressed that to me. So I wanted to make sure she knew that my dad was inviting her to help. You know, I had said goodbye to my folks. I had said goodbye to my son. Anyway, I'm just super grateful for your prayers. Super grateful to God for delivering the message when I needed it most. And I am holding my word. I'm trying to teach as many people about this as I can. So you better learn how to do it, and you better do it. And if it takes doing it every hour for a few days, like it did with us, then do it every hour for a few days. Let's lose a little sleep over it. Don't lose your life over this. They don't want you at the hospital unless you need a ventilator. So we're in charge of our own pulmonary health care until we need a ventilator. You're in charge of your own lung health care until your mom needs a ventilator, etc., etc., etc. I did want to mention before I quit this video that there are some electrical devices on the market. They cost anywhere from $25 to $50. So if you are alone and you're so worried, I don't have someone to do chest percussions on me. There is no one here to drum my lungs. You can buy a little device. You go, I typically use Amazon, but you can use whatever source you want. And go in there under the massagers and look for one that talks about percussion. Don't just get a massager. You want one that says Percussion Massager, because you want it to beat out at your lungs, not just rub your lungs, okay? You want it to beat out. And those are called percussion massagers. So if you're in a situation, you're a mom, you have a little child, you don't think the child could learn how to do it on you, or you're alone, or you have COPD and you're on oxygen and your loved one has to go to work and you feel like you need 2 or 3 sessions during the day while they're gone, go ahead and order one and get one and have them deliver it to your house. You know, whenever you get a cardboard box delivered, you want to wipe it down really good, and you know not to really even go into it for at least a day if you can avoid it. If you have to get right into it, wipe it down first really good with your antiseptic wipes, then get into it, then open it up. Don't touch the device yet. Go wash your hands really, really well. Remember, I have that video on how to wash your hands like a surgeon. Go do that, and then come back and just pull the device out. And now you know you have a clean device using clean hands. You can plug it in. What you want that device to do is not just touch on your chest softly. You're going to do your entire right lung field. Let's say both of these sides are the same, okay? You're going to start at the top above your collarbone and rumble there and rumble here and rumble here. And if you have a boob, you have to rumble down here, okay? Rumble down your sternum. Rumble down your sides. Start in your armpit, work all the way down to your lower rib cage, and then on your back. Now, you don't just want to touch it there. When you touch it, if you just touch it there, your voice, when you go, ah, it's going to sound like this. Ah. But But if it's really pressed against you pretty good, it's going to sound like this. That's what you want. You're wanting that vibration to go through your lungs and bust up all that crappy COVID-19 mucus and the white blood cells and the macrophages and all the serous fluid. Just everything, okay? The mucus that's been formed by your goblet cells along your trachea and along your bronchioles and along all the little bronchus tubes. You're wanting it to go, Gosh, I guess you could just do that, couldn't you? But anyway, I love you guys. Thank you for watching. I'm doing much better. I'm not quite sure when my voice is going to come back, but I think my vocal cords, they've seen me cough so many thousands of times in the past 35 days and hard coughing that I just think they're injured. I hope they're not injured in a bad way. I heard that Patsy Cline had the flu when she was a kid, and because of that, she got really strong lungs, and it changed her vocal cords, so I'm hoping I might sound like Patsy Cline when I start singing again. That would also be a big blessing, wouldn't it? Anyway, y'all have a great day. I love you. Don't worry about me. Dr. Missy's fine. And you will be too. Don't give up. Don't you dare give up, okay? Never, ever, 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 ever quit.